Hey everyone, welcome. Hi Deborah.
Hey, Caroline, how are you?
I'm awesome, and you?
I'm great. And you know what? I got to say, it was so interesting getting ready for our interview today to talk about, well, first of all, I want to welcome and introduce Dr. Russell Kennedy before we just go ahead and start talking about him like he's not here. And
Go
don't
ahead.
worry.
You ladies go. I'll join in. I can
Yeah,
handle it.
we do that. So, very good. But, the topic that we're talking about is anxiety, right? The topic that we're talking about is anxiety. And look, if you guys have been hanging out with us for a while, you know that me and Caroline banter about a lot of products and a lot of topics. And, we've had our own little side conversation about the anxiety of life, right? And so I got to say, Caroline, how are you feeling about doing a show about anxiety?
Well, it's a totally unknown subject to me, so that I've never lived.
Yeah. Really?
Really.
Yeah.
Actually super interesting because I do have two young adults, so 19 and 21, and I have a 12-year-old, and two of them are girls. So I think I'm familiar with anxiety, like going through teenage phases, and it actually brings back a lot of memories. And who doesn't have anxiety? But I think there's some healthy anxiety and there's some non-healthy one. And actually, I'm jumping ahead a bit, but when I started reading the book we're going to talk about today, I was just like, wow, it's really exposing it in a different way. So whether you are familiar with anxiety or not, I think that there's so much to learn about it. And what about Deborah? Are you familiar with anxiety?
Well, interestingly enough, I had this conversation. So if you guys know me, don't know me, I mean, my background is in holistic health. And I ran a massage studio for 27 years and done 30,000 treatments. So I'm definitely been, introduced to anxiety in a number of different ways for a number of different people for a number of different reasons. And the interesting thing to me about anxiety is I love how you said, there's appropriate anxiety. And that I think, like exams or tests, or you're the last one picked in the baseball game, or, you really like someone, but they don't like you, and all that kind of stuff that you go through. And then the different anxieties that the world just presents and learning on how we deal with that. So someone who teaches meditation, I've obviously kind of gone more of that holistic route. And then when I actually had what I think was my first bout of uncontrollable anxiety, where the anxiety was running my game, like the meditation wasn't working, the oils weren't working, the counseling wasn't working, and I had to come up with something multi-dimensional because I couldn't resource myself. And that was that was when my marital status was changing. Isn't that elegant? I came up with that lately. I was like, when my marital status was changing and there was things that I couldn't control over top of my emotions, they were kind of running my game. And I think that was the first time I actually had an understanding of anxiety at a whole different level, and so it was very interesting. And it's been very interesting getting to know our author. We met very serendipitously, which is, honestly, I think some of the best ways to meet. And I saw that he was talking about the brain, and you guys know I'm a little bit of a geek that way, and I just kind of love that brain organ, and just learning from. I love cohesiveness, so I love kind of how to deal with something very multidimensional, and so I think that was one of the big things that drew me to this book. But yeah, so I guess have I had anxiety? Yes, I've had appropriate, and what I would consider appropriate for the situation, but something that I couldn't manage myself. Yeah.
It was a rhetorical question because I know you.
I know that you know me, but I was just sharing. And I think some of the stuff, as a parent, it's hard when you watch someone go through, whether it's a friend or particularly when it's a child. I think when you watch them go through something and you're searching to see if your bag of tricks works, like what did I do to help myself? And is that going to help my son or my daughter or what have you? And when it doesn't, or it's different, you're like, oh, this is very interesting, right? So I think that the more we can learn about anxiety, the better that we are able to cope with pretty well anything, right? Pretty well anything. So with no further ado, I think that we've both admitted that we've kind of, you know, had our own problems, had our own solutions, and what that looks like. But anyways, this is, for those of you that don't know, the book that we are talking about. And Russell, why don't you kind of tell us, I mean, someone writes about anxiety and, oh, did you have something?
It's called Anxiety Prescription, Anxiety RX. Written by Russell Kennedy, Dr. Russell Kennedy. And sorry, I just interrupted you, and now I want to give it back to you. But I'm
not catching. The ball just went. Woo! I'm just gonna let you sit there.
How about I take it?
Let's let her sit there in some uncomfortable anxiety for a few minutes, Russell, and let's say nothing.
I wrote a book on this. I should be able to deal with it.
And okay, it's on you.
Someone, you know, very, very unique, not unconventional. I've rarely met someone like this, a doctor, stand-up comedian, very holistic and very scientific at the same time. So he's a very good, amazing mix of a lot of things that we think don't mix. And I think that's why his book is so interesting and on point. So Dr. Russell Kennedy, I'm going to ask you my first question.
Sure.
Tell us a little bit about you.
Well, let's start with this. I'm a real big fan of why. I love Simon Sinek's book, Start With Why, right? So the reason why I do this is because I struggled severely with anxiety, even though I became, you know, a physician and a stand-up comedian and a corporate speaker and a yoga teacher. I struggled with anxiety really, really badly. There was points where I didn't leave my house. And if I didn't have my dog, I probably wouldn't have left my house. And it comes from growing up with a father who was schizophrenic, and then living in this sort of chaos. And there was lots of good times in my family, but I always knew that the other shoe was going to drop. I always knew that he was going to go psychotic, wind up in hospital. The whole household would wind up in chaos. So I developed this hypervigilance, this sense like, okay, I'm just going to stay on vigilance all the time. So when it does happen, which it always did, I mean, but sometimes it would take months, I would be ready for it. And that became a habit, and that became a habit in my body. And, you know, if you read my book, you'll see that I believe anxiety has much more to do with the body than the mind. I believe it's a stored energy from unresolved issues in our childhood that just reflected by the mind. So the mind gets this unresolved energy and it takes it and it makes a story of it to make sense of it. But the story it makes of pain is going to be painful. And then when we make that painful story, it just makes the alarm that's in our body even worse. So we get into this alarm anxiety cycle. And like Deb was saying, you can't get out of it on your own until you realize that this is what's happening. And that, so for me, my why is I don't want people to have to suffer like I did. I realized that the biggest thing, and if your listeners take nothing more out of this broadcast than this, is when you're alarmed or anxious, I encourage people to use the word alarm rather than anxious because it has a lot more consciousness to it, but stop thinking. You know, I mean, you can't stop thinking, but just start using your attention and your focus to go into your body. Put your hand on your chest. Try and find a place in your body that's at least neutral. If it doesn't feel good, just find a place that you focus on sensation, you know, essential oils, rubbing your fingertips together, something that brings you into sensation. Because what anxiety has done is it's teleported you into the future, and you've made a horrible story out of the future, and then you believe it. Because what we anxiety people hate more than anything is uncertainty. Uncertainty is the thing we avoid the most. So to make something certain, we worry about it. But when we take that worry as truth, we suffer for it. So we get in this cycle that we're not even aware of. So the thing is that when you're in alarm, is to be aware, I'm in alarm right now. I need to go into my body. My mind will not fix this. And like I said, if you can take one thing out of this whole thing, your mind is not going to fix it. When you're in alarm, you have to breathe. You have to put your hand over, you know, find your alarm in your body, which we can talk about later on if you want. Put your hand over it, connect with it, and then breathe into that. And I don't want to sound like some sort of, mystic yogi or whatever, because I have a degree in neuroscience as well. I know all about the bed nucleus of the stria terminalis and how it reflects through your body and the hypothalamic pituitary axis. I could explain all that, but it's really not important. What's important is when you're anxious or alarmed, you go into sensation, you go into your body, because when you do that, all the energy that was forced into time transporting you into the future and your future-based anxious thoughts gets transmuted into your body and into a sense of sensation and grounding. And then you're teaching yourself to actually do something about the original problem, which is this alarm that's stored in your body. Your thoughts you can stick in forever, and a lot of people do, and I did for decades. I was caught in my mind forever, and my mind wanted to convince me that it had the answer, but it was just a trick. Like, it was just a trick. And that's really one thing that I'm just so passionate about, is just when you're in alarm, you've got to get out of your head. You've got to get into your body, move, go to nature, whatever it is. You have to get into your body, because your head doesn't have the answer. In fact, it just has a lot more of the problem. Now, that was a long answer, but I hope it meant something.
No, but
that was incredible. Yeah.
What I find super interesting in here is that, you've said that you've been anxious since you're a kid. And
Yep.
I mean, you did pretty serious studies and you took on a serious career that requires a lot of, concentration and everything. And for me, it's just amazing how, so many people will coexist with their anxiety and
Yep.
everything that they need to do on this side. And you're a proof of it. But like, at which point did you say it's really on this that I want to start focusing?
Well, I guess I just got disillusioned. I didn't want to be on medications. I didn't want to have to go through therapy. I've probably been to 50 different types of therapists, from, high level psychiatrists to shamanic energy healers. I've taken psychedelics, ayahuasca, psilocybin, MDMA, which isn't classically a psychedelic. But I just wanted to examine my own mind from as many different perspectives as I could. I went and lived at a temple in India for a while. I've got a degree in neuroscience. I studied developmental psychology at the Neufeld Institute. Like, all these things, these scientific yet ethereal things, and Caroline, you alluded to this at the start, is that I've tried to been able to amalgamate all these things into a cohesive solution that's helped me. Because out of all these 50 practitioners, it made me feel a little bit better, but none of them really got to the underlying cause. And I didn't see the underlying cause until I went on LSD once, when I was just basically, my back was to the wall and I was pretty close to suicidal. And I saw that my anxiety was actually stored in my body, in my solar plexus. It's purple, it's sharp, it pushes up on my heart, it's hot. It has this kind of edgy, like glass, like ground glass feeling to it. And once I localized that area and I started dealing with the alarm that's in my body, which I also believe is my younger self asking for my attention. I know I'm giving you guys a lot here, but when I connected to that younger self in me, that's when I started to get better. All the talk therapy, all the the other, even EMDR, all that kind of stuff, it helped a little bit, but it didn't really get at the underlying problem. The underlying problem was this old, unresolved trauma that I had stored in my body. And then I think what we do as human beings is, when we have this trauma in our body, we don't want to go back into our body. So what we do is we get trapped in our head, because as much as it feels uncomfortable, it feels even worse to go back to that place of uncertainty, that childhood pain that's still stored in our body. So we worry, and the worries have to get worse and worse and worse to keep us locked in our heads. Otherwise, we sort of fall down into feeling town, and that's a scary place to be. So what I train people to do, and what the book is all about, is giving you a way to start connecting with yourself again. Because I believe all anxiety is separation anxiety, and it's mostly separation from other people in your life when you were younger, and then you separate from yourself. And once you separate from yourself, you just start depositing alarm in your system. So it's a way of connecting with yourself again, so that you can start metabolizing some of that old trauma that's stored in your body that I saw in my solar plexus on LSD. And if I hadn't done LSD or ayahuasca or any of these sort of mind altering substances, as an academic, as a medical doctor, neuroscientist, I never would have seen this. I never would have seen this, and the book never would have been written. So basically what it comes right down to is I had to heal myself. I saw like 50 different therapists. Nobody was really helping. So I said, well, you have all this education. Why don't you use this and become an anxiety patient as well as an anxiety doctor and study your own mind, which is exactly what I did. And that's basically where the book comes from.
Wow.
So it's interesting because you've combined both worlds, or what we see predominantly in North America as holistic and allopathic. How's it been received? So it's interesting. How are people receiving the book as someone who's combining kind of both worlds?
Well, I try and keep my scientific persona with it too. You know, I get really nervous about going on shows and podcasts and talking about the inner child, you know, the trauma stored in the body, because I know people, especially people trained in allopathic medicine and traditional psychology, are going to be like, this is too weird for me. And believe me, as a scientist, sometimes when I talk about this stuff, I want to have a seizure, because it's like the two sides of my brain are just the artistic side, the ethereal side, and the scientific side are kind of like, it used to be hell. It used to be terrible. But now that they've kind of fused together, now that I've kind of developed this cohesive thing, and writing the book has been infinitely helpful for me, because I could all of a sudden now jive the science behind me, which I've, you know, studied since I was 20. And this sort of more ethereal kind of living at a temple in India, being a yoga teacher, all this kind of Olmi kind of spiritual stuff, and put them together in one package. And so, you know, the book's only been out a couple of months, Deb. So far I'm getting the best comments that I get from people, and I've got this about 12 times so far, not that I'm counting, is it feels like you're telling my story. And I just get chills from that. Like, I love that so much, because for me as a child, I never felt like I could tell my story. I had to look after my dad. I had to kind of look after my mom in a way. She was an RN, she worked a lot. So, you know, there was really no one there to look after me. So now that I'm getting this feedback, I realize that I'm not alone, and that a lot of people as children felt alone, and they couldn't express what was happening to them, and they couldn't understand what was happening to them. So for me, that's the best feedback I can get. And I'm ready. Like, I'm ready to, like, if anybody wants to take me on this and say, well, it's not in the body, it's actually in the brain. You know, if you want to talk about the hippocampus, and you want to talk about the amygdala, and you want to talk about how things work and how integration occurs, I can do all that stuff, you know, and I can still stay within this framework of anxiety is trauma that's stored in the body. And one thing that you said earlier on, I can't remember which one of you said it, but it was just like, there's excitement and anxiety, and the body has a very difficult time telling the difference between each one. So often I'll tell people, are you excited about going to this party tonight? Or are you anxious or alarmed about it? And then when they find out, it's like, well, I've had a great time there before. I'm gonna say that I'm excited about it. Now, when you reframe it as excitement, a lot of that story that I was talking about earlier on disappears, right? So that story of like, I'm going to see my ex there. Last time I spilled wine on myself. I drank so much that I threw up on the table, you know, all this stuff. Not that I've ever done this stuff ever, right?
Ever.
But you know, but the difference between anxiety, and I think what happens is the difference between anxiety and excitement gets blurred when you have childhood trauma. When you have trauma that's unresolved, you are more likely to perceive these symptoms in your body as anxiety, as something to worry about, than people that grew up with a detachment that go, I'm really excited about going to this party tonight. Yeah, I'm going to see my ex. Yeah, I might get drunk and do something stupid, but I'm still okay.
Right. And I love how you say, you know, one of the things that makes me feel very calm, and I don't know about other people, and Caroline, maybe you can talk to this, is when you say reframe. For me, it's so solution based, and it takes it from, because there's anxiety before we go speak on stage, but we know that once we're on stage, it's going to go away. But it feels as awful as that anxiety of going into a very uncomfortable situation, right? And so I love how you talk about reframing. I think that's something that anyone, even a teenager, can get their head around, right? Can really grasp the idea of reframing. You know, when I'm doing that, I know that this is more of a radio show of my people, but it's almost like I've got a Rubik's Cube in my hand, and I just want to reframe that, and it just, so it calms my nervous system down to look at it from a different perspective.
Yeah,
Yeah.
totally understand that. But you know what? And I was talking to somebody on Instagram about this last night, and it's like, well, I started to look at my anxiety in terms of probability. You know, like if I'm afraid of flying, you know, the chance of dying in a plane crash is 1 in 26 million. And I said, yeah, I think that's fine. But really, when you're in that alarm state, you've already fallen back into your limbic or emotional brain, and you've lost some of your rationality already. So what I would say, I said to him is, look, do this thing where you focus on your body, where you put your hand on your chest. And if you can find a source of alarm, like I know mine is right in my solar plexus. If you can find that source of anxiety or alarm in your body, put your hand over it, really feel the connection of your own touch, get into your body, because once you get into your body, then you regain blood flow up into your prefrontal cortex, your rational brain, and then you can reason. And then your reason does mean something. But it's like trying to do an algebra problem with someone's got a knife to your throat. Like you can't cognitively solve this problem while your brain is impaired with alarm.
Right.
So you go into your body first, you ground yourself there, then you get your rational prefrontal cortex back, then you can think. But these things where you get into, it's like having an argument with your partner and you're in full force and you're trying to go, okay, rationally, I know that I'm wrong here, but I'm not going to admit it because I just can't. Right? Like I just can't do it right now. I know that I should just admit that I was wrong, but I'm in here full force and I'm doubled down on my original premise because we can't. That's the thing. Right. But as soon as the tide, you know, an hour later, you know, you come back downstairs and you go, you know what? Yeah, sorry about that. I just kind of, and that's what happens. But the problem is when we're in that fight or flight state, we don't really realize that we've lost our rational ability. We still feel like we're us. So when we're fighting with our partner or whoever, we still feel like, yes, this is wrong. This should never happen again. And then, you know, 3 hours later, you go, geez, I don't know why I got so upset about that. I don't know why I went off on that tangent because it just wasn't accurate. But it's because you're in your emotional brain. And when you're in your emotional brain, you'll never get out of anxiety because that's where anxiety, it kind of reverberates through your body. And you have to really, you know, get back into that place in your body, you know, resonate with that. And then you can go back into thinking. And even then it's kind of like, I would prefer people just stay in their body for, you know, 15, 20 minutes. You know, we spend so little time in our body and so much time in our head. We worship, we live in this neck up society now where it's, you know, I'm so busy. You know, everybody's got this badge of honor from being so busy and having so many things to do. And Deb, I know, you know, you don't know what I'm talking about here, but a lot of people put a lot of things into their life that really complicate their lives, you know?
Okay, I think this is where Caroline should take over the conversation.
Exactly.
Because, you know, I'm always looking for something to do because I don't have enough to do. But
no, exactly.
The one thing I wanted to say, and I'll lend over to Caroline because I don't know, something of what you just said really I thought this is really her arena. But when you're talking, and you know, Caroline and I both have teenage children, and as you're talking, I'm taking it in, I'm getting it. I can see myself as an adult, you know, and being in a challenging conversation, needing to step back and go, okay, we're both, you know, the word triggered is really good. Like we're getting triggered. But when you've got a teenager, or you've got a child, it's really hard, I think, as I'm listening to you talk, for them to be able to take themselves out of it's such a self-absorbent state or phase of life. Like you got these teenagers, how do you get them out of, you know, self-absorbency enough to have self-observation, right?
Yeah. I mean, and that's a big deal too. You know, with the screens they have now too, part of their brain and body doesn't develop this sense of, it's called the social engagement system. So part of the social engagement system doesn't develop, and the social engagement system allows us to soothe ourselves. So it uses like eye contact, tone of voice, prosody of voice, body language, all these things that, you know, when I was growing up, I had this with my friends all the time. So I learned how to emotionally regulate based on what they were doing, and my brain matured. But now the kids have all their screens. So in the screen, there's it's face to face on some level, but a lot of the stuff is text. A lot of the stuff is misunderstood. And I think it just creates so much more stress and tension in them, and they don't have the emotional or physical maturation of their brain and their body to be able to incorporate this energy and be able to use it for good. And then they get stressed and they go back to their screens to soothe them when their screens are actually what's starving them for the maturation that they need to soothe themselves. And here's something I often do with kids, with adults that have teenagers or even kids. Often I'll get them to come up and the adult, and you have to work with them because some of the teens are kind of like, there's no way, but just to come up and just put your hand on their chest and just say, look, you know what, I've got you. If you can, put your hand on their back, surround their heart with your hands and say, look, I know you're upset. I know you're upset right now, but I've got you. If you want, put your hands over my hands, and we can just make a real connection here. Now, sometimes they're too activated, but if you teach them this over the course of time, they will learn that they can self-regulate and they can regulate through you. So it gives them, again, it's that whole thing about, you're not going to be able to talk them off the ledge. You have to be able to feel them off the ledge. They have to feel you, and they have to feel into themselves. So the more you can adopt that sensation-based thing, and especially if you put your hand over their heart and their back at the same time, and when they're really triggered, this is not the time to start this, because they'll just resist. But if they're having a rough day, if they've come home from school or whatever, and you can tell that there's something not quite right about it, just like, hey, I just learned this from a doctor that specializes in stress. You don't have to say anxiety, but stress. How about if I just put my hand over your chest right now, and then I put my hand on your back? And sometimes, and I got this from my colleague Amy Culler, and she says, just say that word out loud to yourselves, like, mm-hmm. And if you can resonate, and if you can time it so that you both say it together, and I know a lot of teenagers will just rail against this, and you don't have to, but it really, that vibration, we're just energy, we're just vibration. So if you can get to this point where you can soothe them with your vibration, and they can feel that you're there for them, their whole system will just kind of drop down. They'll start getting blood flow back into their prefrontal cortex, and they'll go, you know what? I did have a bad day today. Stacy told me that, she didn't like my dress, or, my hair, or whatever. So, and then, and you'll see where their prefrontal cortex comes back online, because they'll start becoming more rational. Like I said, try and start doing this when they're not, 9 out of 10 alarm, because they'll just reject it, But if they're upset about something, and then you can use it as a tool. You can say, well, can we use that little thing, and you'll be surprised at how much the teenagers love this, and the younger kids love it too, because you can make a game out of it with the younger kids. It's like, okay, we're gonna play hold your heart. I'm going to hold your heart now. And then if you can, like, rub your fingers together, rub your palms together like this, and get a nice bit of heat there, and then put it on their chest and their back. And man, for young kids, 8, 9, 10, this is incredibly soothing for them. When you put a hand and they can feel the warmth of your hands on the front and the back of their heart space. And again, as a scientist and a doctor, when I start using terms like heart space, I do want to have a seizure. There is no two ways about it. But I know that it works. That's the thing. So getting back to your original question, I am anticipating some pushback from traditional psychiatry and psychology, but I'm ready. I'm ready, baby. Bring it on.
Carolyn, I can feel you. I can feel you. How's it going over there?
There's so many comments I could have made along the way at some point. Feeling like saying, I feel like you're telling my story as well. I didn't know I had to do LSD to actually, find my trauma. But anyway, no, we talked a lot about teenagers and kids, and it's actually something that Dr. Russell had told me last week, and it actually works. Actually works. But I think that what I thought about this week as well is that we need to treat ourselves as a kid or as a teenager as well. And everything, like, quite often we're more concerned about, like, oh, what can I do for my teenager or my kid? But it's all good for us as well. And it's amazing. But what I want to talk about here is, I know that you don't practice traditional medicine anymore, and that you are amazing at it. So I want to ask you, like, when you're so good at something, but you know that there's another belief that is even stronger for you, how do you make that transition? Because like, even now you're sitting here saying, I know I will have some pushback and I'm ready for it. I'll support you. You can put my name on the list, but how do you go from that to that? And because I think that a lot of people will relate to that, because it's also, we face that in life quite often, having to make huge decisions, and
Yeah.
we're into comfort, and the big decisions, we know they will take us further, or they will be more aligned with our values, but that also means like stepping out of our comfort zone. So can you just address that a little, please?
That's so
Yeah.
good. That's so good. Can I just throw something in there?
Oh,
I
sure, Deb.
think that the hardest decision is when someone's going from something that works to something that works. It's
Yeah.
easy to leave something that doesn't work, but when you've got something that you're good at, that you're crafted, that people say, "Hey, you're," and then to leave it, oh, fantastic! You got my ears. I'm ringing.
Yeah. I mean, I was a physician for 22 years, right? And I loved helping people. I really, really did. You know, it was the thing that I really loved most. But working in the Canadian medical system is difficult because they say that we have universal accessibility, which means that, you know, you have the same weight for an MRI that, you know, everyone else has. But what we really had was universal inaccessibility, and that nobody could get their treatments at the same rate. So for me, that became very frustrating. The other thing about allopathic medicine is it's very pharmaceutically based. And I'm a medical doctor, man. I believe in a lot of medications. There's a lot of great medications out there, but there's some that aren't so great. You know, the antidepressants is a general rule I'm not that crazy about, because I find that, you know, and I took them, God, I took them for years off and on, probably over the course of 30 years. And, you know, they make you sweat, they disrupt your sexual function, they kind of blunt you, you know. So, you know, I'm not anxious, I'm not an anxious mess anymore. And, you know, it allowed me to get through medical school and do all that kind of thing. But, you know, the medication, the whole idea of treating symptoms for me, it wasn't, you know, it wasn't that. Actually, it was hard because I didn't quit medicine until I ruptured my left Achilles tendon, because I started getting left Achilles tendonitis, and like an idiot, I injected myself with cortisol and lidocaine, which is basically, you know, like that's malpractice. You know, it worked. I went to Croatia once and I had it and I injected myself and it worked like a freaking charm. So it occurred again 2.5 years later. I did it again, and then I was walking through London Drugs and dodged this kid, and bing, my left Achilles tendon went, and that was the straw that broke the doctor's back at that point. So that was kind of like, hey, you know where you're supposed to go. I think we do know where we're supposed to go, and just we develop all these rational, which are really alarmed reasons why we should stay in the place that we're in. So I had to quit. I had to, you know, I just couldn't take it anymore. I was already burned out. I was already seeing 1 or 2 patients, and then I would have to go into the bathroom and breathe to get myself back into resonance again, even though I was a good doctor. There's no two ways about that. But it was just like, it was killing me, but I couldn't leave it. Like I could not leave it. And then when I ruptured my Achilles tendon, it was like, okay, I'm out. And then from that point on, I went through 2 years of anxious hell for sure. And that's when I did all the psychedelics and all that kind of thing. But I had a mission at that point, and I finally knew that this is what I was supposed to do. And I had to do 22 years in the industry. I had to see it from all sides, so that now when I talk about it, I know exactly what I'm talking about. And I used to talk to doctors all the time about burnout. So for me, it wasn't kind of like, okay, this is not working for me, I have to sort of move, because I think that's, like you said, virtually impossible. You know, so I needed to rupture that Achilles tendon. I needed to go through a horrendous period of anxiety. Not really depression. I don't know a lot about depression, and I'm not really that good of a depression counselor, but anxiety is my jam, man. So I know it. And so that at that point, I developed a purpose in my life. And my purpose was, and I keep saying this, that I don't want people to have to suffer with anxiety like I did. I don't want people to have to go through traditional therapy and think that there's something wrong with them because they're not getting better, right? That, you know, and that actually gets me a little emotional, because it's really hard for me to see people have to go on medication and do all this therapy that really isn't helping them, you know, when really the solution is connecting with your younger self, connecting with that part of you, trying to find that part of you in your body. And you know, that's what I wrote the book about. I mean, the book is basically my life. I mean, you guys are, you know, getting through the book now, so you'll see where my life goes and why I made this decision. But it wasn't that hard of a decision. But by the same token, I had something shoving me into a new direction. So I know how hard it was. I don't think I would have been able to leave medicine. I mean, eventually I would have, but I don't, without that shove, because it was so much a part of my identity too, you guys. Like, it was just, being a doctor was so important to me, because when I grew up, I never felt like my voice was heard. You know, my dad was schizophrenic. My brother had some muscular issues and had a bunch of surgeries on his knees and stuff like that. So a lot of the attention went into those two men in my family. And I just adopted this thing, well, I don't need much. I don't need much for me. I will give to you. And that was why I became a damn doctor. I mean, you don't get a whole lot more codependent than that. So getting back to your original question, the reason I left it was easy on one level because I was shoved into it. But it was hard because I resent having to stay in it for so long. Like, I let myself stay in that for way longer than I should. But I also know, my little ethereal India sense tells me it was perfect exactly the way it was. And the book came out at exactly the right time. And, my thing is that I don't want people to have to suffer with anxiety, because they don't have to.
Right.
The traditional therapies, I don't want to, they don't work. I mean, I don't get myself in trouble. I mean, talk therapy has its role. And I do think talk therapy is helpful. I'm not saying but only doing talk therapy is not going to fix you. If you do talk therapy and you do some sort of somatic work as well, working with the body, then that gives you the best chance to actually heal from this, as opposed to, just going through talk therapy. I have friends who have been going to therapy once a week for 20 years, and they're not a whole lot better. Right. And one of the jokes I used to tell on stage, and I'm almost done, I know I'm taking a lot of time, is, if you had a leak in your house, right? And this plumber came by every week and he made the leak just a little bit better, would you keep paying that guy $200 a week for years and years and years and years and years? Would you keep paying that guy? No, you wouldn't keep paying that. After a while, you kind of go, look, I want someone to fix this leak permanently. So that's kind of what I offer. And that's why I'm ready for some pushback. But you know what? I think that the psychiatric and the psychological professions are really ready for this. I think they're really ready for it, because I think they know at a consciousness level that what they're doing is not really working. It's helping, but it's not really working. So that's why, I'm really going to focus on getting this book out to therapists so that they can start using these techniques as well. And because I think it's just really important just to take our mind off trying to fix the mind, because what if the problem isn't in the mind and we spend all this time trying to fix it up here when it's down here, and we're never going to fix something, up here when it's down here. Like, we're just not going to do it.
Right. I love that analogy. And I think that you're right. I think that there's been a great opening, right? I think there's been a great opening for quite some time now. And I think it's uncovering and uncovering and uncovering, where people are becoming more open on both sides. There's people, coming from a holistic teaching. There's people that allopathic was like, no, I'm never going to do that. I'm not having my baby in a hospital. If I get cancer, I'm going to the shamans in India. I'll never do that. And they were very adamant. And then there was allopathic, where there's like, don't even talk to me about aromatherapy, because that's voodoo magic. And so, right. And so I think what we've seen over the course of the years, there's people like yourself where there's some coming together. Some people are a little more on this side, some people a little more on that side, but I think that our canoes are actually going down the river pretty well at the same pace now. I do. So I think that I got to ask you. So I mean, you were a comedian. You got to talk a little bit about what that was like and how that's added to your life. And then honestly, where do you want to take this? You've written the book. You've talked about what you hope it does. What do you do now? Do you see clients? Do you do stage presentations? Like where are you at with what it is that you're doing?
Well, with COVID, it's hard, and something you were saying, I wanted to address that first. The thing about this book is it comes from a medical doctor, right? And I think that's what's going to shake them up almost more than anything else, because they can't discount me like I'm, an alternative health practitioner, which I have personally benefited from a lot of alternative health practitioners. So I think the mainstream is going to have a real hard time kind of discounting this, because it does come from a neuroscience, it does come from an MD, it does come from a grounding in developmental psychology. So I think that's really important to get the acceptance ratio. So I don't get the immediate, no, that's all woo. That's not gonna, we're not gonna fly with that. But I think it really comes down to what I want to do with this is I want to just get the word out. I don't have a firm idea. I have in the last few years just kind of let the wind take me where I wanted to go. And now I'm being faced with, I've got to decide, because if I don't have an intention where this is going to go. But part of me, money isn't a huge deal for me. I live in a beautiful house 2 blocks from the beach in Victoria, got a wonderful wife, stepkids, grandkids. I don't need a lot. I mean, I would like more money for sure to get this word out. I would love to do that. Now, the method I do that, I'm not sure. I mean, the book's only been out 2 months. One-on-one stuff does tire me out, because what I do is I kind of read people. Like I'm not going to say psychic, but I read people and I see things in people, and I show them where their anxiety is, and I show them what they have to do. So they don't have to see me like week after week after week. I show you, here's what you have to do. And then maybe through 2 or 3 months or 6 months later, they come back and they go, that was great. That's exactly what I needed to do. So I'm not sure, Deb and Caroline, where I'm going with this at this point. I know one-on-one stuff does tire me out. I have thought about doing like a subscription model where I do like a Facebook Live or something once a week and then take questions. And I'm doing an interview with Nicole LaPera in a couple of weeks, and the holistic psychologist. She's got like 3 million followers on Instagram. So I'm sure that will, expand my reach as well. And she loves my book. So it is one of those things where I think it's going to expand organically. But I think you're right. When I talk with you, you're very good at kind of going, okay, where are you going with this? And it's like, and I resist you, and that. And I was like, okay, I don't know exactly. So thanks for the push, because I know that I need it. But there's a real resistance there, and I don't exactly know where it comes from.
Well, I think it's beautiful to be able to be in that place. And Caroline, then let's me and you chat a little bit, but I think it's beautiful to be in that place. And I know that myself and Caroline, we do a lot of business together. We've got a business, we've traveled all across Australia. We've got the podcast where we're soon to be our first authors of our first book within the next 30 days. Ooh. And we've done, right? We've done many projects together, and people could say that to us, right? I'd be like, I could call Caroline. So where are we going? And I think had we 6 months ago said, Caroline's like, she's going to sleep. A year ago, if I said, hey girl, where are we going? I mean, I remember sending her a message. I'm like, we're going to be on stage together one day. And she's like, oh, that's crazy, Deb. But then all of a sudden, here we are going in that kind of direction. And sometimes I don't think but I think you feel it. You know that there's movement, but you don't know how it's going to show up.
Right.
And I think as co-creators, right? So Caroline and I co-create with each other, sometimes creatively, we're gonna put our hands on our heart and we're like, so we create with each other, and we're good kind of, we see the different side of the same story.
Yeah.
But I think that's a brave place to be honest with you, where you are, where you're in that state of not knowing this, but you know your purpose.
Yeah.
But how it's going to show up, you don't know. Right? That leaves the space for whatever. Some people say God, some people say universe, some people say serendipity, some people say circumstance, for things to show up. Because if you're closed off, then it's not a very creative place to be, yet staying focused. It's an interesting.
I personally think that the hardest question to answer, and I'm not even sure I've answered it to myself, is what's your purpose? Mm-hmm. And because making plans like, let's do a book, let's do this, that takes guts and planification and energy, or you need a crazy friend, one of the two. I mean, when you have your purpose, for me, that's the foundation of everything, because the rest will come. Like, it's easy to learn how to plan and proceed and act. It's very hard to really be 100% sure, like, this is my purpose and that's why I'm there. And that's what I admire about you. And I'm actually not worried at all about where this is going for you, because I know it's going to go where it needs to go. And I just want to add, like, I'm a professional patient with lots of years of experience. I think the first time I consulted someone, I was probably like, I don't know, 13 or 14. And my whole life on and off, I've been seeing therapists, different kind. And I've been starting something and then dropping it because I was always like, it doesn't work. Like there's something in me that knew like I'm wasting my time. I felt like at a lot of times, meeting number 4, I was teaching them something, or I was like kind of playing the conversation and I was just like, why am I here? So I kind of stopped. But honestly, when I read your book, and I'm not going to say I read it all because you even suggested don't read it all in one thing because there's a lot of chapters in it because it's short chapters. There's a lot to take in, but it's really the first time that I read about a subject that concerns me so much since I'm little. And that for me, I always, mixed depression and anxiety. And I found it so interesting that you said, I don't know anything about depression. And yet you were always anxious. I was just like, I thought they were like going hand in hand, and apparently they don't. But my point to this is that it's the first time that I read a book, and honestly, page 1, I got right into it. And it's a book where you learn so much, but at the same time, it's captivating and you want to keep reading. Like when you read a good novel, you're into it. And then when you read something that you need to learn, usually you're like, okay, I need to do my 10 pages tonight. And you read your 10 pages and, you are the perfect mix between the two because it's learning and it's very captivating. And I think that this is the answer I was looking for because like I said, therapies don't work for me. I don't do them. I don't finish them. I start them, but I'm always like, no, that's not that. And I think you brought the answer, in this podcast. It's like, you need to connect with yourself. And that's one thing that no one teaches you.
No, I think we do get into this whole thing about overthinking and that thinking will solve your problems. And on some levels, thinking does solve your problems. If you have if you're not making enough money, you have to think, okay, I've got to, but I think we lose so much feeling and uncertainty is where life is. So if we don't allow ourselves to feel and we don't allow ourselves to embrace that uncertainty. So my whole premise, like I said, I'm going to wrap it up with the whole thing about stop thinking. When you're feeling alarmed, you're not going to solve it up here. In fact, you're just going to make it worse. So start feeling, start getting a place in your body where you create a safe place and it's safe to go. I have stuff on my websites, hypno meditations on there you can go to that start creating this place in your body that allow you to go into there without going into that old alarm. You don't have to go down into your body and dig up all that old trauma. You can find a new place and you create a new place. And in fact, that's exactly how I healed. And that's exactly how I show other people how to heal. So that's what I would say is stop thinking, start feeling, and learn how to feel and learn how to just embrace the uncertainty, because that's where, there's no uncertainty. There's no anxiety when you just embrace the fact that you don't know.
That's phenomenal. I think that's a great place to leave it off. I think and if people want more, then they can contact you. They can read the book. They can certainly go onto your website. Russell, what is your website so people can go to that?
All my stuff is the Anxiety MD. All my stuff, like my website is the Anxiety MD. My YouTube channel is the Anxiety MD. My Twitter is the Anxiety MD. So if you just Google the Anxiety MD, all my stuff comes up. I'm pretty easy to find these days.
Well, that's awesome. You make it simple and easy.
Branding.
Dr. Russell Kennedy, it was an honor to have you on this podcast. Thank you. And I think we should do a follow-up interview in a year.
Sure.
Just see the progress, and maybe you won't have time to talk with us.
Oh, I'll always have time for you guys.
That was phenomenal. That was really phenomenal. And I love it. And Caroline, I got to say that the journey that we go on together and the ability to be able to interview people like Russell and just, what it is that we do and how we do it. It's so phenomenal. And I really got to say that, obviously we're all in business, and a lot of people that are listening to our podcast are entrepreneurs and lifepreneurs and very much own their own business or are part of their own business. And I've always said, personal development over business development will make you more successful every single time. And it's one of the reasons why Carolyn and I believe that we are so successful in what we do, is because we literally, honestly, if you saw the side conversations we had, we're in our stuff, we're doing the personal development, ugly stuff, and it shows up, and we get rewarded. And so, we've both had an experience of having some of your great insights, and it's just been a real pleasure. It's just a real pleasure to be on the call with both of you.
Well, thank you, and ditto.
Ditto. All right, so we're gonna finish off with a ditto.
Yeah.
And we'll call it a day.
Yes. Thank
Thank
you.
you, ladies.
Thanks,
We'll talk
everybody.
again.
Okay, bye now.